All righty. See that everyone's filtering through. So I think we can go ahead and get started. Next slide, please. All right, welcome everyone. Welcome to our webinar, Advancing Access and Equity, Moving Away from Shelter Workshop Towards Competitive and Integrated Employment. Thank you everyone for being here today. My name is Amy Moore. I'm an intern at the National Association of Councils on Developmental Disabilities. A little bit about us. NACDD is a national association for the 56 councils on developmental disabilities, DD councils across the United States and its territories. The DD Council receives federal funding to support programs that promote self-determination, integration, and inclusion for all people in the United States and developmental disabilities, developmental disabilities. Okay. Today we are here today in observance of the National Disability Employment Awareness Month, NDEAM, for October, where we celebrate contributions of America's workers with disabilities, past and present, and showcase supportive, inclusive employment policies and practices that benefit employers and employees. Next slide, please. Today, we'll discuss the importance of competitive and integrated employment for people with disabilities. In the next hour, you will learn what competitive and integrated employment is, CIE, hear from a self-advocate about his employment journey from a shelter workshop to CIE, learn about the common barriers and the national transition towards CIE, and learn about the efforts our Nevada DDD Council has made towards eliminating the sub-minimum wage from their state, or in their state. And also lastly, learn about how you all can help advocate for CIE. Towards the end of the webinar, we'll open up for a Q&A session where you'll have the opportunity to ask the panelists some questions. Right, next slide. All right, and now I'm pleased to introduce our three panelists today. We have David Pinno. He's a self-advocate who pushes for Wisconsin to be inclusive and supportive of individuals with disabilities. David has been instrumental in advocating for the Medicaid purchase plan reforms, Employment First, Partners with Business legislation, and the Wisconsin ABLE law. David is a past board member for the Wisconsin Board for People for Developmental Disabilities and the New London Homeless Shelter. Next, we have Julie Christensen. Julie is the Executive Director and the Director of Public Policy and Advocacy at APSE, the Association of People Supporting Employment First. Prior to joining APSE, she was the Director of the Iowa's University Center for Excellence in Developmental Disabilities. Julie's background encompasses work in schools, non-for-profits, government, and higher education. For the past 15 years, her career has centered around improving quality of life outcomes for at-risk youth, including youth with intellectual and developmental disabilities, through promoting employment and access through leisure and recreation of opportunities in inclusive settings. And lastly, we have Kimberly Palma-Ortega. Kimberly is the public health liaison overseeing emergency preparedness, access and functional needs, and community health work for the Nevada Governor's Council on Developmental Disabilities, NACDD. She represents the council and the IDD population across multiple boards, councils, and commissions in varying roles statewide, promoting access to health services by connecting individuals within their community, while increasing knowledge, self-advocacy, education, counseling, and social support through outreach. Kimberly works closely with the State Emergency Operations Center and emergency planning staff across the state. She's been a part of the disability community for over the last 23 years, as she is also a proud mother of 5, 2 of which have various IDDs amongst other rare complex medical conditions. Welcome everyone, and thank you for being here today. Next slide, please. First, before we start, I'd like to give a bit of background information as to what competitive and integrated employment is. So competitive and integrated employment is having a job where you earn at least the minimum wage, at a comparable rate to another employee without disabilities, performing similar duties with similar training and similar experience, while working in a common place of employment typically found in the community, interacting with other individuals without disabilities, and where you're presented with opportunities for advancement, similar to other employees without disabilities in similar positions. However, many people with disabilities are not given these rights due to a law under the Fair Labor Standards Act called 14C, which allows employers with a 14C certificate to pay people with disabilities less than the federal minimum wage. This is a practice that occurs in shelter workshops. And for those that don't know, a shelter workshop is a place of employment that pays people with disabilities sub-minimum wages in segregated environments. However, for many years now, there has been a push to ensure all individuals with disabilities have access to competitive integrated employment and to pass legislation to support towards eliminating sub-minimum wage. And we can stop sharing after this. But now that we have that bit of background info, let's move on to David and hear about his employment journey. David, are you there? I think you're muted.
Can you hear me?
Yes, we can hear you.
Yes. Okay. Okay. Yes. Yeah. Hi. My name is David Pinno, and in 2003, I ended up in a sheltered workshop in Wisconsin because after high school, I had trouble keeping a job. My pay when I left in 2011 from the sheltered workshop was $4.28 an hour. My first paycheck from WCI or the shelter workshop was $47 for 2 weeks. I felt worthless, and the environment was very strict. I was often retaliated against for speaking my mind, and I had no free will, basically. I now work at McDonald's in the community. I am being paid $13 an hour, and I am valued and respected. And I own my own house as a result of being able to afford things now that I'm not making sub-minimum wage. So that's it.
I have a few questions. So while working at the shelter workshop, what kind of work did you do there?
So I was pretty much a machine operator for a company called Sturm Foods in Manawa. They actually subcontracted with the shelter workshop, making like oatmeal, packaging oatmeal, different things of that nature. And I was a machine operator. I would frequently work alongside of a den worker, which was a person with who was hired on to kind of work at a higher rate, but they were getting paid the $7.25 an hour minimum wage, and I was only making the $4.28 an hour.
And so one question for you. So what made you why did you decide to leave, and like who helped you leave in that process?
So what made me decide to leave and what really happened was I had some internal conflict that happened at WCI or the shelter workshop. And it prompted me to, instead of putting in my 2-week notice like any other job would require you to, I was very unhappy, so I abruptly quit that job. and nobody really helped me do it. I went out on my own to do it. Um, Now, how I got hired on at McDonald's was I started out working at McDonald's in New London. And because I was so good at what I was doing, basically, and I had the governor come to Wisconsin, and he actually, the governor of Wisconsin, come to my McDonald's and work alongside of me. And then basically, I was being paid $9 an hour there, and I transferred to Greenville McDonald's, but I'm actually making more money there than I was at New London. But the reality of it is that instead of staying at sub minimum wage, I've actually been working in the community. So
And I have a final question for you. What do you like best about your current workplace?
I feel like I can be myself. I feel that I don't have to be somebody I'm not in order to make numbers that don't really result in a sheltered environment. I felt like I was constantly being retaliated against. What I like about my current job is that there is no retaliation. They treat me like a human being. Um, and that's all that really matters is having a job where it's meaningful and I'm treated with respect.
Thank you, David.
Thank you.
Now, let's move on to Julie. Julie, are you there?
I am here.
All right. So a question I have for you is, what are some of the common barriers to competitive and integrated employment, and what is being done on the national level to make sure people with disabilities get CIE?
Sure, thank you. And on behalf of the Association of People Supporting Employment First, I'm grateful for the opportunity to join all of you, our DD Act partners. So very grateful for that opportunity. And before I kind of get into some of the barriers, I wanted, if I could take just a second to bring us back to your definition of competitive integrated employment. Because I think one of the things that's interesting to me when I'm asked to talk about advancing competitive integrated employment is that we use how we use terminology doesn't mean the same thing to everybody. And that's particularly important when we're engaging in public policy. So to break that down a little bit, and you did such a great job, Naomi, in talking through the three different aspects of the definition of competitive integrated employment. But I want to focus on kind of the two key pieces that determine whether employment meets that definition. One of them has to do with the wages, and you did such a great job talking about that. And David, thank you for sharing your story and the ways in which working under 14C certificates and earning a sub-minimum wage is a challenge. So that is a barrier to competitive integrated employment. But there's also the settings piece, where employment is happening. Is it happening in the community, or is it happening in a facility? And a lot of times when we talk about sheltered employment, we use that term as kind of an all-encompassing term that implies that someone is in a facility and earning sub-minimum wage, when in fact, it could be one or the other. Someone could be in facility-based employment, but earning at least minimum wage, which is the threshold. Or somebody could be out in the community, but being paid on a 14C certificate and earning below the minimum wage. So when we talk about advancing competitive integrated employment, what's so important is that it's the full definition. Really what competitive integrated employment is about, and what that definition in the Workforce Innovation and Opportunities Act was intended to do, was to ensure that people with disabilities, specifically people with the most significant disabilities, have full access to participation in the general labor market. So same work for same pay, meaning if you have the same job description as somebody else, you should be paid a comparable wage regardless. And so I think that's another piece when we think about some of the barriers to competitive integrated employment that we often miss. So 14C allows the payment under the federal minimum wage. However, paying minimum wage in and of itself is not competitive integrated employment. If someone can make $20 an hour, but you are only earning $7.25, which is the federal minimum wage, and it's might be different for some of you who are watching in different states where state minimum wage is higher, but that differential is the difference, right? So just because you're earning $7.25 an hour does not mean you are earning the same wages as everybody else. And so when I think about your question about the common barriers, I think there's a lot of confusion when we talk about advancing competitive integrated employment. And because of that, it creates a challenge in the service delivery field that is intended to help support and break down these barriers, because whether it's our funding or our policies, we are not always aligned in a way that is putting forward the outcome that we say that we want. So full participation in the general labor market. Are we able to provide the appropriate supports and services that allow that outcome to happen? And the answer is that we can't. In most states, non-work services for people with disabilities funded under Medicaid are reimbursed at a higher rate than employment services and supports. So if we say that we're advancing competitive integrated employment, but it is more expensive to do that type of work, it disincentivizes the outcome that we're looking for. So I think funding and capacity issues become a real challenge. I think some of the other common barriers that we hear a lot in this space is around low expectations for the ability for people with disabilities to work competitively. And we also hear the barrier that employers themselves are hesitant to hire people with disabilities due to a variety of factors, maybe not understanding what a disability is or how to help somebody, or having some sort of preconceived notions or stigma around disability. So there, I mean, I think there continue to be a lot of barriers, but what I want to kind of focus in my last minute here is some of the emerging facilitators that are helping us achieve competitive integrated employment. So the good news is we have so many more tools in our toolbox, so to speak, that help support the outcome of competitive integrated employment. We have a variety of different models of supports, whether it's supported employment, customized employment, the IPS model, which is a mental health based model for supporting people with dual diagnosis or simply just with mental health challenges. We have great and emerging assistive technology that also helps contribute and allow people with disabilities to participate in the workforce in ways they've never had to before. But beyond just the tools that we have, we really have changed culture in a lot of ways. So there's been for many, many years, a huge emphasis on school to work initiatives that aim to end that pipeline from leaving the traditional kindergarten through 12th grade, high school, into sheltered employment, into non-work services and supports. So we are being much more intentional in the way that we set the expectation for employment and help young people with disabilities as they enter the school system as early as pre-K all the way up till they exit the school system, really be thinking about their career options and desires, and that there's skill building involved in their curriculum to help support that outcome. Our policies are still behind. So 14C is still in existence. We need to change that 1938 Fair Labor Standards Act law that you mentioned, Naomi. Our funding streams, whether it's vocational rehabilitation, whether it's mental health funding, whether it's Medicaid funding, they are behind the times in prioritizing the outcome of competitive integrated employment. And that continues to create a barrier, but there's a lot of good things that are happening. In the Medicaid space, the home and community-based settings rule has mandated that Medicaid funded services and supports need to happen in the community. So That's great. That helps move an entire service system to away from the notion that non-work services and segregated services are where we should be investing our time and energy. But there are other funding mechanisms that support people with disabilities towards employment that don't have those same rules that we need to continue to work on. There's also been a lot of work to phase out 14C, and I saw that there was a note in the chat about 14C. So just to reiterate what that is, it's a certificate that a business can apply for that allows them to pay below the minimum wage for a person with a disability, typically based on a productivity scale. But there are 15 states across the country that have ended the use of 14C certificates, and there are federal initiatives happening right now to end the use of 14C nationally. And I think the last point that I would make that is an interesting, unexpected consequence of the COVID pandemic is that we see businesses and the community at large thinking very differently about employment outcomes and opportunities for people with disabilities. And there's two reasons for that. One is that most facility-based employment had to shut down during the pandemic in most states because of the need to social distance. And so it created a situation where we had to help people with disabilities find other mechanisms to work. Many individuals never returned to sheltered workshops. Many sheltered workshops never started up again when some of those social distancing restrictions were lifted. Many did, and we still need to work on that. But the other piece is that people with disabilities were disproportionately deemed essential workers, showing up every day at our grocery stores, at our gas stations, at, you know, those essential businesses where people were still working throughout the pandemic, and really has changed the conversation around the contribution that people with disabilities make in the general labor market. So I think while we still have a lot of barriers, there are some hopeful trends that I hope help to further the conversation and ultimately lead to better outcomes.
Thank you, Julie. Kimberly, are you there?
Yes, ma'am.
Okay, great. So Kimberly, can you tell us a bit about Nevada's history with shelter workshops and your council's work with advocates and legislators towards eliminating the sub-minimum wage?
Yes, of course. Thank you again, as everyone else has stated, for having the Nevada DD Council present and able to have this kind of conversation and dialogue, which is really just nice to see overall. So with that, we already kind of know that sub-minimum wage was intended as a job training tool to provide employment opportunities for people that would be otherwise considered under federal standards unemployable. Unfortunately, the majority of sub-minimum wage jobs occur in sheltered workshops. And with that, it kind of leads to where we're at right now. So in regards to that, the Nevada DD Council has worked nearly on every legislative session since 2001 to eliminate the phase out of sub-minimum wage. And currently, we've noted that since 2001, in a government audit, we found that 5% of sheltered workshop participants ever transition, into a standard job. And then further into all of that, as we noted in the beginning of 2023, at least 402 people with IDD were still currently being paid sub-minimum wage on ID waivers. With those recent numbers, we've seen a change in the dialect in how employers are starting to catch on and note that there is a great opportunity in seeking those with disabilities to be employed. Some of that at this point right now, we've never missed during this legislative session any chance and discussion on the 14C waivers. We took that and the individuals that we have been working with over a number of years and really allowed them to use their voice and to make those changes for our state. In that, we were really happy to give them the opportunity to allow them to decide what was best for them. Lastly, noting in some of the questions that you just asked right now too, is that because we were able to educate them on their rights, more people wanted their voices to be heard. So every single person, when we send out our slideshow as a follow-up, you'll see a whole bunch of individuals that took the time to testify over a dozen times on various bills as well too. And then we were able to work alongside one of our legislators, Tracy Brown May, and push the bill AB 259, which would phase out the sub-minimum wage by 2028. And then I know you asked a few more questions into that. So if that is okay, if I continue on, unless there was questions that you would like noted. I know the council really pushed for recommendations through education to our legislators on recommending the increase to maintain, reallocate funds for transition work programs, as well as recommend strengthening funding for self-employment, as well as initiatives to be self-employed. Another set of recommendations that we helped try to push to is to be proactive in policies for federal, state, and local government agencies to recruit, hire, and train and mentor people with developmental disabilities. We also asked and recommended that they provide incentives to employers to support integrated community employment at above minimum wage, at minimum wage or above. Also, to implement employment first policies to transform expectations from state agencies, state service providers, as well as people with developmental disabilities. And lastly, we also asked and encouraged them to engage with private sectors to raise awareness about the support for inclusion of people with developmental disabilities in the workplace, and to provide those forms of training as well. And I know that the phase out will also prohibit the payment of wages less than the state's minimum wage to recipients of job training services no later than January 1st of 2028. With that, I think that was it, unless there was any other further questions that I can add to, because we've always got something else additional to say. I just want to make sure we're following your schedule, Naomi.
Thank you. We'll have an opportunity for more questions at the end, but we can move on to, I do have a question for all of you. If we, sorry, let me move this a bit. So my question for all of you is, for people watching who are currently working in a shelter workshop, what kind of resource exists for them to help get out and get CIE? And what can us, the public, do to help advocate to continue promoting CIE? If anyone wants to start, just jump right in.
This is Kimberly, if that's okay.
Yes.
All right, so I had noted a few things. One would be, again, as Julie noted, at that school level is really where I think we have our greatest aim to make those adjustments and those priorities very fluent as we navigate school. And something that the DD councils can do, since we are in every state and territory, is getting that information out to those local schools. That way the DD council can help share those resources and guide people into those local areas and supports and advocates and things like that. Number two would be get involved with your DD councils, whether that's become a DD council member or a member of a subcommittee. Number three would be also engage with DD partners. So that is your protection and advocacy agencies, as well as your NSEDs, your universities for excellence. That we all are DD partners. We're obviously federally mandated to that standard through the DD Act. And with that, we can always make sure to have the most updated information that comes across through legislation and other areas of interest, to make sure that you're up to date on any changes, because I know we have a lot of questions on what happens if we get, what are the waivers, what is that going to look like for some of your services. So those are good places for you to navigate some of those questions with as well too. And number four, the DD councils often have a program called the Partners in Policymaking course that we put on. So that allows for you to have and build off of some good skill sets for legislating, testifying, getting your story heard, understanding the legislative process, connecting you with legislators as well as other like-minded individuals, and you're in a pool of, you know, other individuals across the nation that can kind of help even move federal movements as well too. So, and that goes in and out of legislative sessions that we can go ahead and provide those additional pieces of information. So again, just using what we currently have, we have a good sound standing, relationship among the states with our DD councils and with APSE and things like that too. So however we can share that information amongst each other and throughout, the other areas within each state, please use us as deemed necessary to be able to help promote and get some of those questions and answers that you may need addressed.
This is Julie at APSE. Just to add to that, those were great suggestions, Kimberly. I think, for someone who is in a sheltered workshop, but wants to look at competitive integrated employment, there are a couple of great avenues. If you're funded by Medicaid, talk to your case manager, explore what service options might be available to you, and don't allow the provider who might be supporting you to dictate what those services are. So for example, if you are working with a provider that doesn't offer, for example, supported employment services, it is okay to seek another provider that can offer those services. I think sometimes people with disabilities are, for lack of a better term, kind of tracked into services based on what their provider thinks is best or can offer them versus what the individual themselves wants. So advocating for the desire to work competitively is a great first step. And then looking at what are the options that are available to you. Beyond the service system, though, I think there are a number of things that people can do. Reach out to your own networks, your neighbors, your friends, people you go to church with, people you see in the grocery store. Are there opportunities to do an internship, to job shadow, to just get an idea of what is out there in the world that might be of interest to you, and that you might want to do as a career? Or another way of doing that is to think about what your skills and interests are and then specifically target some businesses to say, hey, I would like to get some work experience. So, I think there are some tangible tools. I love that Kimberly was really promoting needing to start early. And there are many people who have not benefited from the expanded effort for school to work transition that have not had the opportunity to really explore what else might be out there. So just having the conversation and raising your voice to say, this is what, I want and what I would like to try. I think, for DD councils, as well as for the USEDS and the protection and advocacy folks, the three-legged stool of the DD Act. I think, those of us that have worked in those systems have an obligation to help people with disabilities recognize their choice and to let them know that they can ask for something different than what they've always done. Because, you don't know what you don't know.
Thank you, Julie. David, do you have any advice that you'd like to share at all?
Yeah, so there is, so if you are looking for a job in the community, and if you want help, go through like your local DVR or Department of Vocation and Rehabilitation, or go through DRW, which is Disability Rights Wisconsin, or a disability advocacy organization. Those are very important tools that people can use. The biggest thing is don't give up and don't let people tell you that you can't do something. That, I guess, that's the biggest message that I have. So.
Thank you, David.
Yep.
So now it's at a point of time during the webinar where we open it up to the rest of you. So now it's your chance to ask questions. and put your questions in the chat, or we can unmute you and you can ask your question. Just everyone just raise their hands if they have a question. So I'm going to open it up and then see who has their hands raised. Let me see.
Looks like Lauren Gherkin has been waiting for a minute.
Okay, so Laura.
Hey, I am Lauren. I'm with the Texas DD Council. We've had a little bit of progress with minimum wage elimination in a state use program. So really honing in on if it's a public, state funded group that they should not be paying some minimum wage. But I'm really interested in that productivity mindset. Yeah, I feel like a lot of people with disabilities here who end up in southern workshops are ending up there because of that productivity. Like, you have to meet certain standards to be in the community idea. And I'm just curious to hear what luck anybody has had in really having that conversation with legislators to get people away from that mindset and get people to understand that, we all have different levels of productivity, and we should not be putting people with disabilities in the productivity mold that we've designed for them. We should be honing in on, like I think Kimberly or Julie was saying, looking at those skills and looking at those interests. And I like what Kimberly was saying about starting early in the school system. How can we kind of improve that dialogue in that check?
So this is Julie, and I'll jump in because it is an excellent question, and I think the productivity scale piece that's associated with 14C, it's important when talking with legislators to put it in context. So in 1938, when 14C was first put into law, to be completely honest, in 1938, it was revolutionary. We weren't talking about people with disabilities entering the workforce at all. We were largely just institutionalizing people with disabilities. What 14C was designed originally to do was to have this productivity scale that was designed to help move people towards what we now call competitive integrated employment. So the idea that an employer would be willing to hire someone who could maybe only do 20% of the work, but it still is an opportunity for a person with a disability to start, but that the anticipation and the expectation is that you're continuing to provide services and supports until that person can get up to 100% productivity. But let's talk productivity in general. The economy at that time was very much manufacturing based. It was what we call a widget economy. And so how you measure productivity was very much based on kind of an assembly line mentality of, you need to do X number of things in, Y amount of time, and then you could calculate what that ratio is. Our economy is not like that. There is no place in the general labor market for people without disabilities where we measure productivity in that way and base compensation in that way on a day-to-day basis. And I think that's something that legislators sometimes need to be reminded of, is that we are forcing a metric on people with disabilities that doesn't exist anywhere else and therefore is not comparable. So what a productivity scale doesn't do is take into consideration that the work that somebody's being measured on might not even be a job that they like or a job that they're well suited for. And just because you're not well suited for the job doesn't make you unemployable. It means it's not a good job fit. And I will give you a personal example that, my very first job was working at McDonald's, and I am highly distractible and I kept burning the French fries. I got fired because I kept burning the French fries. Working at McDonald's was not a good fit for me, but that didn't mean I was unemployable. And so that's where the conversation, when we talk about people with disabilities in the labor market, we need to be really careful about what that productivity scale is based on, because it never was intended, and yet it's used often as a measure of someone's worth in the entire labor market for the rest of their lives. We all learn, we all grow, we get better at what we do. And if we're not getting better, then perhaps we're not training correctly, we're not providing the right supports, we're not utilizing assistive technology in the right way, or it's not a good job match, and let's find a job where a person can excel and thrive. I loved David's story about the way in which he's explored a couple of different options for himself in that same way. So those are just a couple of strategies that we've used.
And it's really interesting. Thank you, Julie, to think about and find that jobs that exist today weren't even in the minds of people back in 1938. So the job market is so much more diverse. It's that's really helpful. Thank you.
Hey, thank you. Thank you for that question. We have another person with their hand raised. Kimberly, you have your hand raised?
Yes, this is just kind of a follow-up to what was just asked right now, is that, a good platform for us to kind of get that change rolling and moving is using our, DD Council's 5-year state plans. When we send out those surveys for public comment and input, really kind of entertain who it's going to, look at the platform and where it's being sent. Also, the DD Council has a platform too to get out materials to all, levels, birth through death, using their position statements and that to promote educational materials for legislators and local state program agencies throughout, and organizations. For example, the Nevada DD Council, we had a YES transitional youth program, and we're currently working with a grantee right now on that same kind of platform that has us in the schools. And then also use the state stakeholders that are sitting at the table on your DD councils, make public comment at those meetings, or get on subcommittees as well too, just so that we can get the ball rolling and have your voice heard, at least on some of those measures or conversations or concerns that people have as well too. But I just wanted to give that additional insight as well.
Thank you. Okay, so we have Laura Evans. Do you have a question?
Yes. So kind of to piggyback on what Julie had just kind of said, I have disabled children.
I think we have a hard time hearing you. Do you mind coming closer to the mic?
Okay, are you hearing me better now?
Yes.
Okay, sorry about that. So,
it's cutting out again. I'm so sorry.
oh man. Okay, are you hearing me better?
It seems it goes in and out when you're speaking in the microphone.
Laura, would you like to write your question in the chat, and that way Naomi can read it? I think that might be an easier way. Sorry if that might take a little bit longer.
I think that might be an easier way. Just if you can put your question in the chat and then we'll respond to it. Okay. I think we have, let me check the chat. I wasn't looking at it. Do we have any questions in the chat?
Question from Emily Davis on evaluating the setting parts of the definition of competitive integrated employment. It's somewhat of an involved question.
Where's that question again? I'm sorry.
Sorry.
I'll just go ahead and read it if I'm right here.
Yes.
I'd like some guidance on how to evaluate that settings part of the definition of competitive integrated employment in terms of the degree to which the place of employment is found in the community and the degree to which workers interact with non-disabled workers. There's a big upward trend in self-employment, which is neither, quote, in the community, end quote, nor involves coworkers. Is that still considered competitive integrated employment? Also, what about jobs that don't usually involve much interaction with others at all, like a pool cleaners or groundskeepers that tend to work alone?
I'm going to jump in because it's an excellent question, and I'm going to add one, Emily, to what you added, because one of the things that we've been monitoring really closely as a result of the COVID pandemic is the impact of remote work on employment for people with disabilities. And in many ways, it has created tremendous opportunity for people with disabilities to participate in the workforce, particularly when transportation has been a barrier, or perhaps the need for intensive supports that are hard to do within a work setting. But it's a great question because there's the spirit of competitive integrated employment, and then there's, to your point, how do you really evaluate it when you set it side by side with someone else? If someone never leaves their home and their only way of working is by computer from their own home, but there's no interaction in the community, do we consider that competitive integrated employment? Right now, our laws and our policies are focused on distinguishing between segregated employment, meaning employment only for people with disabilities, versus integrated employment. So CIE is about integration, but it doesn't define a percentage. Depending on where you are, for example, I know state use contracts were brought up earlier with federal procurement, the Ability One program. There are ratios under law that have to be abided by in terms of how many people with disabilities and how many people without disabilities can work in a setting. So it is a little bit complicated, right? So the letter of the law is, that you have to be able to work in an integrated setting with people with and without disabilities and have access for up to upward mobility within that setting. But there's no concrete definition that helps you really drill down how you look at one setting versus another in various contexts. And certainly remote work is making us really look at this very, very differently in terms of what the spirit is of full participation.
Kimberly, would you like to add on?
Those are really great points and something that really could be entertained. At least in ours, we had some interim sessions going on right now. That would have been really great to kind of have that in their talking ear as we move forward in that next following legislative session. But again, just reiterating, the more you can work with your DD councils and connect with those legislators, you can find who your key stakeholders are, that we can engage those kind of conversations and using the DD council as well too to do focus groups and set up some town halls to have that kind of community engagement. But also just taking another step further too is that I'm not sure if all states have the 700-hour program, or if their state is using the model employer format too. But again, just iterating what each state is doing versus where you would like to see it going, and then finding those states that kind of have that maybe one or two steps in ahead of the game, where we can kind of try to navigate again using the DD network and facilitating getting some of those answers across the nation answered versus the state, because we have to obviously navigate that differently until it goes federal, and then try to move some engagement conversation that way too. So just not narrowing down some of the requirements statewide and then moving it forward so we know how to play the game and navigate the chess pieces appropriately, so that we don't discourage each other either, knowing that, you know, one of us are a little bit ahead or further behind. So it's just, again, educating ourselves, knowing how to research and to navigate who's the right people to ask those questions to, would really kind of help us, give us a stronger platform for seeking change.
Thank you. And I think we have time for at least one quick question. Nantine, if you
Yes.
want to ask a question.
Hi. So, hi, Julie. In New Jersey, okay, I understand that the CMS HCBS setting rules actually tend to be successful in preventing segregated employment in states that use Medicaid funding. And in New Jersey, our DDD actually has been closely following HCBS setting. However, in New Jersey, DVRS, the Division of Vocational Rehabilitation Services, uses state fund to finance sub-minimum wage, segregated employment, whatever you want to call it. And so my question is, of course, at the state level, you could try to advocate legislators and administrators to make changes legislatively. But I've been around New Jersey for a while, and I know, you know, it's not going to happen so quickly. Okay, I think Julie understands. My question is, does the RSA that governs how VR agencies use funding and so on could do something? I mean, other than at the federal level, other than ODEP looking at how 14C is being administered. I really feel that any changes for a state such as New Jersey would have to come from the national level. So my question.
And you know, Nancy, that I agree 100% with that. I think, you know, those of us that spend our days working with Congress find ourselves increasingly frustrated by how difficult it is to do anything, quite frankly, at the federal level. And in some respects, there are many members of Congress that just kind of throw up their hands and say, well, let the states take care of it. And some states are. We have 15 states that have passed legislation. 10 of those states just since 2021. So this is a fairly new trend. But you're right, there are some states that will not make this move on their own because there are vested interests in how the state budgets are allocated and the ways in which products and services purchased by states are purchased. That it's going to take federal. So, you know, I think we continue to push at the state, but this is not or maybe it is kind of a chicken and egg conversation, right? Because you need both. Like, we have to be doing both. We have to push states that we can make progress in. And I think, you know, I would love to see more DD councils in states where there's an opportunity to really push in the way that Nevada has. But there are other states that are not going to be able to do this on their own. And that's where we need support from DD councils and states to help us really understand what the challenges are in a state like New Jersey, because that's what folks on Capitol Hill need to hear about the reason why that federal move to end 14C needs to continue to be a priority.
Thank you. I know that you can resonate with my question. Thank you.
All right, I think we have arrived at time. Eric, do you mind pulling up the slide?
Bring it up.
Okay. Thank you. So, all right, it's 3:59 and it looks like we're at the end of our time. First, I'd like to thank you all, everyone, for coming today. I hope this was an insightful webinar for you all. I would also like to thank the members on our panel, Daniel, David, Julie, Kimberly. Thank you all for being here today and having the willingness to share all your knowledge and expertise with us. I just want to quickly share our contact information. You can check us out at nacdd.org. We're also on Facebook, LinkedIn, Twitter, Instagram, YouTube at NACDD, the National Association of Councils on Developmental Disabilities. Okay, thank you, everyone. This concludes our webinar, and I hope you enjoy the rest of your day. Thank you. Let's see.